Okay, in this portion, we're going to be looking at facial bones, auditory ossicles, and the hyoid bone. So here, when we look at the eye and we look at the orbit, right up here, this bottom portion, but let me get my marker on here, the pen. Let's use black right here. So this section here on the underneath portion is called the orbital rim. And where the teeth set in to the maxilla, right, to these portions in here, that's called the alveolar process. The alveolar process. It's part of the maxilla. Okay, and we also have it part of the mandible as well. This portion here. Right at the base of the nose, right? So let's say here's the nose. When we look at the inferior portion, the tip of the maxilla, we have the anterior nasal spine right here, which would be right here, anterior nasal spine. So here's the anterior nasal spine, here's the orbital rim, and then these portions here are the alveolar process. Here's the anterior nasal spine again. When we look at the inferior portion of the skull, we rotate underneath, we're looking at the maxilla, and this is the palatine process. The palatine process is this portion here, which is the anterior 3/4 of the hard palate. That's the palatine process. Again, the palatine process right in here, the anterior 3/4 of the hard palate. Okay, we know that this was the ethmoid sinus, and then here is the maxillary sinus, and then up here was the frontal sinuses. And here's the palatine bone, which is the posterior quarter of the hard palate. So here was the palatine process, and here's the palatine bones, the posterior portion, the yellow portion. Again, back here. This is the 3/4, and this is the 1/4 palatine bone. In purple is the nasal bone. Nasal bone, nasal bone. From the lateral view, nasal bone. Close-up view, nasal, nasal. We've already done the vomer. And let's just review what we did here. Right. So this was the vomer. This was the perpendicular plate. Here's the cribiform plate. And then the cristigalla on the inside. Middle concha, inferior concha. Again, vomer, perpendicular plate, middle concha, inferior concha. This is the inferior meatus, middle meatus. Inferior nasal concha, inferior nasal concha. Okay, now, let's move this. Here's the zygomatic bones here. This happens to be the temporal process of the zygomatic bone right here. Temporal process of the zygomatic bone. This is the zygomatic process of the temporal bone. Okay, it's a little bit tricky. So this is the temporal process of the zygomatic bone. This is the zygomatic process of the temporal bone. Again, zygomatic bone is a temporal process of the zygomatic bone. Now, this is the nasal bone. And then if we go just lateral to it, we have the lacrimal bone, L. And then so this would be lacrimal. The green is the ethmoid. And then the purple is the sphenoid. So it's less, right? L-E-S. From medial to lateral. Lacrimal, ethmoid, sphenoid. Lateral, lacrimal, ethmoid, sphenoid. So this is the nasal bone. This is the lacrimal. This is the ethmoid. And the rest of all this is sphenoid. When we look at the lower jaw, there's a few areas that we need to review. This is the mandible. Right here is the angle of the mandible. This section is the ramus. This is the mandibular notch. And the mandibular notch, we have a condylar process. So this right here is the mandibular condyle. And this portion right here is the coronoid process, the coronoid process. Now this condylar process, the condylar process gives rise to this head of the mandible. And right at the head, this is that articulating surface for the TMJ. So the TMJ stands for temporomandibular joint. It's going to fit into that fossa right here, the mandibular fossa right here. Right? And that's how the jaw opens and closes, right at that TMJ joint. So again, this is the mandibular notch. Here's the mental foramen. That's the hole. There's two of them. We have the alveolar process, again, of the mandible and the maxilla. Of course, you have the teeth. And on the inside, there's this foramen here. And we can also see it here, called the mandibular foramen. Mandibular foramen is not the same as the mental foramen. Okay. The mandibular foramen is on the inside, whereas the mental foramen is more external. It's on the outside. Here's the condylar process. There's your mandibular notch. There's your coronoid process. And there's the head of the mandible that's going to articulate with the mandibular fossa to make up the temporomandibular joint. Okay, if I'm not covering it, then you don't have to put it in your database. Let's look at the ear. Now, remember I said inside the ear, there was the petrous portion of the temporal bone, which is really, really important. It's all of this external portion of the temporal. And I said what's underneath it is really important because we'll find the cochlear there. And you're also going to find the semicircular canals. The cochlear, this portion here, is for hearing. And then this portion here, the semicircular canals, are for your balance. Okay, so here's the auricle of the ear. We have sound waves that are going to come in to that external acoustic meatus. Meatus is a canal. This is external. It's an external acoustic for sound. Acoustic meatus, so the sound vibrations are going to hit the tympanic membrane. And that tympanic membrane is going to vibrate. It's like an eardrum. It's like hitting a drum with a stick. It's going to vibrate the three bones of the ear, known as the ossicles. The malleus, the incus, and the stapes. Those are the three bones, the malleus, the incus, and the stapes. And these bones are going to vibrate back and forth, and this vibration is going to send this vibration all throughout this cochlea where there's fluid that's going to stimulate all these little organs inside, these little hairs, and it's going to vibrate them. It's going to send a signal into these hairs in what we call the organ of Corti that's in here. And it's going to change from a vibrational frequency. That vibrational frequency goes into the nerve, and the nerve sends that vibrational frequency into the temporal lobe of the brain, and it converts it to sound. That's all sound is just vibrations. Okay, so that semicircular canal and the cochlea are hidden in the skull, and it's covered by that petrous portion of the temporal bone. Okay, and the nerve that goes to the ear is cranial nerve number 8. It's called the vestibulocochlear nerve. Vestibular is for balance, and cochlear is for hearing. The vestibular portion goes to this, and the cochlear portion goes to this for hearing. The only bone in the body that doesn't articulate with any other bone or make a joint is the hyoid bone. There is a greater horn, and there's a lesser horn, and there's a body. We're going to look at some of the foramen of the skull now. Let's take a look at some of the foramen.